So one thing we see a lot in our office is plantar fasciitis, okay? And the one big thing you have to understand is how to differentiate it, and even if it's truly differentiatable from a heel spur, okay? So a lot of people will get pain in and around the heel. A lot of times if they get this pain here or they get this pain here, they think automatically it's going to be a heel spur. So what do? They go to the podiatrist, they look at an x-ray, and there may be some increased calcification. There may be a heel spur there. But what I want you to understand, when it comes to things that show up on x-ray, it takes a long time for calcification to increase to a point where you can start to see spurring or arthritis, etc. And so what has happened? Why is that spurring? A lot of times it's the tissue that's connected to that heel that is causing this increasing in calcification or is becoming calcified. So instead of us just thinking, well, I'm going to go in there, I'm going to stick a needle in there, I'm going to put some steroid in there, or which will weaken the tissue, or I'm going to have that bone cut out. What you can do, a lot of folks can do, is even if they have a heel spur, is you address the tissue around that heel. Because if you address the tissue around the heel, you could probably prevent having to even mess with going in and having someone go in with an injectable or something like that too. And what does that mean? Watch some of our other videos, some of the rolling, the stretching, etc., that can help to reduce that plantar fasciitis and that inflammation around the heel and that tightness of that tissue around the heel, because then it's going to flow more freely around those jagged, potential jagged parts on the bone that have been there for a pretty long time. And so if they're constantly, beating up on tight tissue, if you can loosen that tissue, it's going to give it some slack, and then you can reduce that pain and hopefully get to a point where you don't have to worry about going in more aggressively with any type of surgery or injectable, etc. So try that.